Alright, now let's talk about our nervous system medications, nervous system classifications. So we have our autonomic nervous system, which controls the autonomic or involuntary functions. So our sympathetic, parasympathetic nervous system. And as we're giving medications, this is where we break it down into our alpha 1, alpha 2, beta 1, and beta 2. So our alpha 1 is that peripheral vasoconstriction. So I'm going to give them something that is going to peripheral constrict so that I'm getting blood, I want to increase blood pressure, whatever, back to heart, lungs, and brain. So that peripheral vasoconstriction. Then I have alpha 2. So that peripheral vasodilation. Have very little or no bronchoconstriction with our alpha 2s. Beta 1. So I've got increased heart rate, increased automaticity of the heart, increased heart contractility, and increased conductivity. So beta 1s are going to really work on that heart. Beta 2s, I've got bronchodilation and vasodilation. So as we're giving these medications, I'm looking at that sympathetic nervous system. And we have those sympathomimetics. As you are, those drugs, medications that have the opposite effect or inhibit the sympathetic nervous system, they're known as the sympatholytics or anti-adrenergics, which antagonize or fight against the effects of the sympathetic nervous system. The drugs that counteract the action of something else are called antagonists, while your drugs that bind to the receptors and cause a response are your agonists. So many of our medications that belong in the beta blocker category, we're looking at controlling their blood pressure in some patients and controlling heart rhythm disturbances in others. So our beta blockers work by filling a portion of the beta receptor sites, the portion to which beta stimulators would normally bind. In this way, beta effects are prevented. In pre-hospital setting, you will often administer your drug that agonize the beta-1 receptors to treat cardiac arrest and hypotension. The stimulation of these receptors increase your myocardial contractility. In contrast, by antagonizing the beta-1 receptor lowers the blood pressure by limiting the myocardial contractility and the heart rate. It also decreases impulse generating in the heart and slows the conduction of the AV node, thereby treating a tachycardia. So I'm working both sides of it. My beta 2 selective drugs cause bronchodilation with little effect on the heart, which only has beta 1 receptor sites. Stimulation of the beta 2 receptors allow you to treat asthma and other diseases and cause the excessive narrowing of that can cause the excessive narrowing of the bronchioles. So our beta 2s will help us open up those bronchioles and those alveoli. Those drugs affecting the parasympathetic nervous system, the agonists to the parasympathetic nervous system are also known as parasympathomimetics, and antagonists are also known as parasympatholytics. One of the most common parasympatholytics is the drug atropine, which we usually use for our symptomatic bradycardia or for our exposure to our organophosphates and certain chemical nerve agents. Parasympathomimetics are also called cholinergic medications. because they stimulate the cholinergic receptors to which acetylcholine normally binds. So as you are treating these patients with that sludge, so our salivation, sweating, lacrimation, urination, defecation, drooling, diarrhea, GI upset and cramps, emesis, muscle twitching, miosis, that's usually my patient's going to be exposed to a fertilizer, a nerve agent, insecticide, sarin gas. Hopefully we get at least enough information that we're like, I'm not going in. I've got to have a hazmat team. We're not qualified, and then work on getting the resources we need there. This a lot of times is where we get emergency management involved. They have to go pick up kits at hospitals and get them out to the scene. Parasympatholytics are also called anticholinergic medications. They block the two types of cholinergic receptors, muscarinic and nicotinic. Your muscarinic cholinergic antagonists block acetylcholine exclusively at the muscarinic receptors. Your atropine, for example, is a muscarinic cholinergic antagonist. It decreases your secretions, increases the heart rate, dilates the pupils, and decreases the GI system activity. On the other hand, that nicotinic cholinergic antagonist blocks acetylcholine exclusively at the nicotinic receptors. This inhibition effectively disables the autonomic nervous system, so it is virtually never used. So that is your nervous system drugs.